What are cytotoxic drugs, and how do they work for leukemia? Imagine a treatment that targets the very cells causing a disease, aiming to stop it in its tracks. That's what cytotoxic drugs do in leukemia treatment. These drugs are a type of chemotherapy that work by damaging the DNA of cancer cells or stopping them from dividing and growing. Leukemia is a cancer of the blood-forming cells in the bone marrow, and these cells tend to divide rapidly. Cytotoxic drugs are designed to attack these fast-growing cells to reduce their numbers and control the disease. Cytotoxic drugs mainly interfere with the cell cycle, especially during the phase when cells copy their DNA, called the S phase. One common drug used in leukemia is cytarabine, which is an antimetabolite. It mimics a building block of DNA and gets incorporated into the DNA of leukemia cells during replication. Once inside, it inhibits enzymes needed for DNA synthesis and repair, leading to DNA damage. This damage triggers the cell to die, especially in cells that are actively dividing, which is typical of leukemia cells. Other drugs used include alkylating agents, which form bonds with DNA bases and prevent the strands from separating, stopping cell division. Anthracyclines like daunorubicin and doxorubicin intercalate into DNA and produce free radicals that damage DNA and cell membranes. Vinca alkaloids such as vincristine disrupt microtubules, which are essential for cell division. These drugs are often combined in treatment regimens to maximize their effectiveness against leukemia cells. Because leukemia cells tend to divide quickly, cytotoxic drugs also affect normal rapidly dividing cells, such as those in the bone marrow, digestive tract, and hair follicles. This is why side effects like hair loss, nausea, and lowered blood counts are common during treatment. The goal is to use these drugs in phases, starting with induction to rapidly reduce leukemia cells, followed by consolidation and maintenance phases to keep the disease under control. Sometimes, leukemia cells develop resistance to these drugs. They can do this by pumping the drugs out more efficiently, repairing DNA damage faster, or avoiding cell death altogether. This makes treatment more challenging and highlights the importance of ongoing research to find better ways to overcome resistance. Overall, cytotoxic drugs remain as a mainstay in leukemia treatment, especially for acute types. They work by damaging the DNA or disrupting cell division, targeting the cells that are dividing the fastest. These drugs are often used in combination to improve outcomes, but they also come with side effects that need careful management. It's essential to remember that each person's response to treatment can vary, so healthcare professionals tailor therapies to individual needs. Always consult with a medical team for personalized advice and the most current treatment options.